Hello and welcome everyone. I am Molly Murray, President and CEO of the Autoimmune Association, and we are so glad you're joining us today for this important conversation called Navigating Your Path, Living and Working with Chronic Autoimmune Disease, hosted by Immunovant. For so many in our community, managing a career while living with a chronic autoimmune condition can feel overwhelming, it can feel isolating, or even impossible at times. That's why we're committed to providing guidance, support, and informational sessions just like this one, where shared experiences and expert insights can help light the way forward. Today's program is part of a broader mission to empower individuals with autoimmune disease to live full, self-directed lives. Here to share more about what you can expect from today's session is Cheryl Hostenak from Immunovant. Cheryl, welcome, and please take it away.
Thank you, Molly, and hi, everyone. I want to add my welcome to the program, and on the behalf of the advocacy team at Immunovant, it's my pleasure to thank the Autoimmune Association for working with us on this. We really appreciate their partnership and greatly value the work that the Autoimmune Association does in supporting people living with autoimmune diseases. I'd also like to extend our appreciation to each one of you in the community as you guide our daily work. Just quickly, I'd like to introduce Immunovant for those who aren't familiar with us. We are a clinical stage immunology company dedicated to enabling normal lives for people with autoimmune disease. We develop targeted therapies that are designed to address the needs of people with autoimmune diseases. You can learn more about us at immunovant.com and our corporate LinkedIn page. About 4 years ago, we began what has become known as the AIM program. AIM stands for Advocacy in Motion, which is a skills building program that we've developed for US-based patient and professional advocacy organizations like the Autoimmune Association. Over the last few years, we've been lucky enough to get to partner with the Autoimmune Association on a variety of these educational programs, which some of you may have attended in the past. So thank you for being here again for today's program. As Molly said, today's program will be focused on navigating career with autoimmune disease. The goal is for you to learn how to integrate your professional ambitions and your health. We'll do this by reviewing a typical journey for people managing career in autoimmune disease, strategies to navigate each stage, and learnings from people who have been there. There will be an opportunity to address questions towards the end of the program, so please be sure to drop your questions in the Q&A chat box. In addition, we'll have a survey at the end of the program, which you can access via a QR code on the screen. We really would appreciate your feedback and want to be able to continue to develop these programs that meet your needs. So if you could take a minute or two to complete the survey at the end of the program, we'd really appreciate that. And with that, it's my great pleasure to introduce you to Michelle Irving, our presenter today. Michelle is a pioneer in the chronic illness and leadership space. She's known for her transformative approach to integrating career and chronic health conditions. As the founder of Career and Chronic for Professionals and Chronic Illness at Work for Organizations, Michelle's innovative companies provide a new way forward for managing your ambitions and health. With over 18 years of experience navigating her own autoimmune condition and a successful career, Michelle combines lived experience with professional expertise, teaching you how to flourish in your career while living with chronic illness. What we can say is Michelle just gets it. Her life's work and living legacy are dedicated to empowering people while they live with chronic illness. Her work is underpinned by extensive training in somatic therapy, cancer survivorship, and women's leadership. With that, I'm pleased to hand it over to Michelle.
Thank you so much, Cheryl. It's lovely to be with you all. As you can tell, I'm an Aussie, but I'm pretty connected with the US and the US environment. So what I'm going to share with you today is the career and chronic map. One thing I want to share with you before we do that is my expertise is in navigating the career with chronic illness. I'm not a lawyer, and so you will, if you need legal advice for how this might apply in your particular organization, then absolutely gather that advice for yourself. But for the rest of the process in sharing, I'm really thrilled to be here with you. So, one of the things that I absolutely experience for myself and in working with everyone is that chronic illness will naturally lead you to authentic leadership. And that's really our starting point for today, because many professionals, many people working are living with chronic illness, and you no longer have the bandwidth for a lot of inauthenticity at work. In fact, you have to prioritize what is real and true and sustainable for you. So this is relevant for you whether you're on the front line in customer service, whether you're one of our beautiful clinicians even and you're living with chronic illness. This applies whether you've got a leadership team that you're managing or whether you're a team member. What is happening with chronic illness when it turns up for you is that it changes the way you relate to work, and it changes what happens for you at work. And so you end up leading yourself through the process of working and what your capacity is. And all of those skills combined with you start to communicate in a different way. You start to think about what's beneath the surface and what your values are and how the work is lining up with that. That comes through the journey of chronic illness. And all of that becomes the foundation for authentic leadership, even if you're not in a leadership role. Because what happens through this process is you start to strengthen your own professional boundaries and you start to deepen your trust. And we're going to talk about the relationship with trusting yourself, with having confidence while working, while navigating chronic illness. As that trust in yourself deepens, all of that gives you more and more skill to lead not only yourself, but almost as a default leader with others. So let's talk about why this is. And one of the reasons is it's an inside job. So what do I mean by that? The fact that you are navigating work with chronic illness, a lot of the sense of place that you will go to work out what to say, how to do it, what your capacity is inside. To do this in a really healthy way for you, it's great to actually understand what your talents are, what your expertise is, and what your resources are. So, when I'm talking about resources, what I mean is to understand that your gifts, your expertise, your analytical skills, your sales skills, your creative skills, your professional skills, your communicating skills, all of those are actually yours and they form part of your resources. And when you are navigating work with them with a chronic condition, it's fantastic if you can rest back in those skills and also strategize from them and have the confidence in those skills that are yours. A lot of what will come up when you're trying to do that is you'll have your capacity, depending on your treatment, depending where you're at, your capacity might be impacting some of those skills. If you can work out with those skills what your capacity is, I like to think of it as peopling. Peopling is really what it takes to interact with others. All of us have different levels of comfort, different levels of skill with interacting with others. Sometimes your medication and your treatment might impact on your capacity to spend time in meetings or to spend time in customer service or to spend time with, if you're a nurse, with patients. All of that might impact on your capacity, how long you can do it, in what environments you can do it. This is how you're looking at what your skills, your expertise are, looking at your capacity, and that's an inside job to then work out how to honor that with integrity, how to strengthen your professional boundaries around that, and how to lead yourself through that from the wisdom of what you can do. I'll talk more about this as we move into the career and chronic map, but I wanted to give you a feel for what your resources are and how to map them against your capacity. And we'll be able to talk even more about it in Q&A. So the next question is, how do we actually get there to our authentic leadership, understanding the integrity of our capacity and our skills? The biggest thing to know, which you already understand, is it's not a linear process. Instead, there's a cyclical process that goes on while navigating your career with chronic illness. And there are 5 key stages, which I'm going to walk you through today. And the goal of our discussion, the goal of navigating these stages is sustainability. Because mostly what happens is we all know what it's like living with an autoimmune condition. When you get a bit of capacity or a bit more capacity, you will push that capacity to its maximum. And then often you will crash as you've burned all the energy. And then you'll recover in the crash to whatever degree that is for you. And then as soon as there's a hint of another piece of energy, you'll go with it, because the reason we do that is we think we don't know how long this is going to be here. We don't know what is going to happen. Let's get as much done as possible. That cycle can lead you to a burnout cycle in itself in your capacity. And there are times for some people in their careers where it doesn't restore in the frame that you need, and it can lead to what I think of as unnecessary resignation. And the reason I'm saying it's unnecessary is if we can navigate the process in a different way that builds sustainable energy for you without the push to the crash, then we have an opportunity for you to stay in employment. At least we're strengthening that. And so there's this push and pull between the medical reality and the career expectation, and the map helps you navigate it. So let's move on to the map. So this is the career and chronic illness map. It's designed out of my lived experience as well as my professional expertise. And it's been tested with many, many people navigating their careers in lots of different professions. What is happening in this map is that sometimes it's not linear, but the first stage I think of as off-ramping. It's where you may be on medical leave, you may have pushed through to that crash position. It may be that medical treatment has taken you to that place and you off-ramp from work. We're going to talk about how there are super practical things you can do in that stage that still keep you connected to what's important for you. Then you may on-ramp back to work, where you're returning to the work that you had. You may be applying for new jobs, or you may be returning to a previous role or a new role within a previous organization. And there are certain things that happen in that stage. The third stage is really important because we don't often think about this, and that is that even if you're going back to an old role, even if it's exactly the same job that you were doing, even if you were having treatment before for the condition that you have, it will still be new. There will still be, as you on-ramp and return in, there may be new people. You probably have a new daily routine if medication has shifted or your capacity has shifted. You may be adjusting to a new identity and a new way of being with your condition, and you may have new working arrangements. It all depends for you on your role and what's happening for you. The reason I talk about this as new is often we expect to come from the on-ramp straight into the next stage, which is 100% back, organizing, doing what we can doing, or pushing our bodies to be back to normal, be back to what was before. If we don't relate to it as new, then we don't give ourselves the chance to embed new sustainability. So the fourth stage is test and redesign. This is where you will spend 80% of your time working out how to work with career and chronic. And in this stage, we're really seeking stability. You might be renegotiating things. You might be disclosing or sharing to certain people. Disclosure is not a one-off experience. It's actually often an ongoing experience. Different circumstances, different people. You'll have your healthy professional boundaries and you'll have clarity about your capacity. And that's what you're consistently testing and redesigning. And then all of this leads to authentic leadership. And the fifth stage is that you'll be really focused on your career of choice at this point in time. You'll really be speaking from your empowered boundaries. You will have expansion, even if your capacity is still contracted. And you'll write a new biography for yourself that isn't the sick person at work. Even if you don't identify with that, we're often afraid of having that label. So what I'm going to do now is take you through the stages and talk about the practical things at each stage. So in the first stage, this is often seen because of the culture we live in, because of the environments that we're in, and because of the story of illness. We have a cultural story of illness that basically says you have symptoms, you might get sick, you'll get some treatment and diagnosis, you may even get a little more sick, but once that's sorted out, you'll return to full health. That, as we know, if you live with a chronic condition, is what we would love to have. However, it's not often the reality, and we're managing chronic conditions while navigating the work, and it's not about being at full marathon health capacity. So what can happen in the off-ramping stage is that we can feel like we have potentially failed at work or not been able to hold up to work. And then we're in this medical limbo stage. We're in this capacity that is really contracted and we don't quite know what to do with this stage. What the mind will often do is sit in this stage and say, okay, what is my strategy for exactly how I get back to work? Now, once I get there, I will do this, this, and this. And there's this tremendous mental and emotional pressure that we layer onto this stage that literally can drain our capacity and even make us feel more fatigued or at times hopeless about how we'll work this out. So let me give you an alternative in what to do in this stage. So this stage, I want you to see it as almost you enter a cocoon. And as your capacity might be a bit contracted, then in that cocoon, your job is to identify what helps here just to navigate this stage. Because there's something about coming into a relationship with the cocoon of it. Here you will often strip down in your identity and your values, and what is important to you will start to emerge. You will also learn to navigate in a place where clinicians are working with you, family members might be around you. You're trying to work out how to have power and agency here in a space that might feel powerlessness. As you do that, you'll learn to advocate for yourself. Now, there's lots of skills and tips that we could talk about in this stage if we had the rest of the day. But the number one thing here is to work out what really helps, including who helps that is helpful, and what capacity you do have, and to have that deeper inner conversation about your values, what's important to you. Now that you have literally some space, what is it you might like to do in the future, almost as a dreaming phase? It is not a phase for actioning. It is a phase for being in the cocoon and being with what is happening. The next stage, as you come out of that, is that you might on-ramp back to work. Now, it might be that you are in the cocoon, you get perfect treatment, something really clicks in, and you skip all the way forward into test and redesign. But for the purpose of working through the stages, let's talk about on-ramping to work. So in the on-ramping stage, what we're really talking about here is taking what's happened in the dreaming and the cocoon stage and starting to work through it now back into life. So this is a process of exploration. It has a lot of discernment in it because this is where you're really going to come into relationship with your capacity and what it looks like at work. You are going to be shifting from the cocoon into the new, and you might be returning to work, applying for a new job. In this space, your focus is re-engaging with work. It might have interviews, it might have resume, it might be about disclosing what's happening for you, it might be about negotiating new conditions or a new role. If you see this as on-ramping, what this gives you psychologically is a sense where your brain can focus then on this is about returning to work in a new and empowered way. So what you're doing here in this process is really thinking about what does it look like for me? This is not about focusing on getting into 100% health, but living in the baseline of your capacity and aspiring to your optimal capacity. And I want to share with you what I mean by that. Most of us, when we're moving back into work or even at work, we talk about our capacity and what's possible from what we aspire to and what is our optimal capacity on the best day, the most perfect process, exactly what we can do at that most expanded experience, as if that is our normal everyday experience. That sets us up for the sense of feeling failure or for confusion about our capacity or feeling that we have to then come back from that position. If you think about your capacity as what is your baseline capacity on your most contracted day, what does it look like for you in terms of how much time can you spend peopling, how much time can you spend on different tasks, what environments is it like for those tasks? What is actually your baseline? Most of us don't want to look at the baseline because it brings up a whole lot of emotion. However, the baseline actually gives you a realistic process of your bandwidth between your baseline and your optimal capacity. And when you have both of those in your awareness, you're in a much better position to navigate the work and navigate it in a way that does work for your body, that is sustainable. Because when you're looking at that optimal capacity and setting that as your normative, you're constantly trying to reach up to that. Now, the reason I'm sharing that as we talk about on-ramping is this is a great time to look at that baseline and potentially optimal capacity, because that baseline at this point might shift over time as you go through the next stages. So the next stage is the new. And this is the stage we often skip over. And there's a really important reason I want to share this with you that has been so effective for me and so effective for people I work with. When you see it as the new, you have a different relationship with yourself and you have a bit more compassion, a bit more creative energy around it, rather than feeling that you're oscillating by trying to meet the consistent benchmark and why isn't your body meeting that? When you're in the new, it really is about thinking, what am I learning this time that actually is new? If I'm coming back from treatment or I've got new medication, I am actually doing that in a new way because I'm learning how this medication is interacting with me and my role. The other thing about this is that you can often have an emotional process where you're adjusting to the identity that has reshaped out of potentially being in the off-ramp situation. Some of that identity can be that you're more deeply integrated into your values in a way that it's starting to drive your behavior in a much more structured way. And you may or may not have new working arrangements. So if you see this as the new, it gives you a orientation and perspective to have that compassion, work with your capacity, and then make the adjustments, whether they're internally for yourself in how you work, whether it's about what's sustainable around the home life, around the working, or whether it's at work. So it's an important stage that often gets skipped over. And it gets skipped over for this. Test and redesign. It's my favorite stage. It's not everybody's favorite stage, but it is where you will spend most of your time. If you see the way you are navigating work as a testing and redesigning process, while we might get fatigued from that, it actually gives you a perspective to work with it practically. So you are working out what is sustainable in this stage and what brings your system stability. You're also working out what to share and with whom, and what is the most empowered way to share that. And I want to talk to you about how you can do that. Just a really quick flip that will bring more capacity into your system. Often what we do when we are sharing about our capacity is that we share what we can't do. I can't do this, and we start to apologize for all the things we can't do. And that can really fatigue your energy, and it doesn't give you anywhere to go necessarily in the conversation. So here's how you flip it. You think about what you can do and you work that through whatever the role is, whatever the position. I want you to go and look at it and then work out what you can do. And then look at that in terms of how long you can do it, in what environment, what works best for your capacity. And I'll give you an example. So you might be great if you're in an office and you use analytical skills and you're reading reports. It might be that that's better done in the morning or the afternoon for you. So just pop that in as that's what you can do, and this is what makes it, the optimal for you. And what you're doing when you're talking at work is you're thinking about it as what is the optimal way in which the work can get done. And optimal means works for you and your body, and the task gets done to have the impact. It might be that you're in a frontline role and you're thinking about, okay, standing works this way. I'm on my feet a lot. What are the ways in which I can ensure that my body gets the break in that process? And how can I design this so that I work in ways that give me that break for the body? That's what I really mean about the baseline and the optimal in both, and getting clear on your capacity about what you can do. Because once you speak from what you can do, then the other person that you're sharing it with is in a conversation about what you can do, and that starts to move the conversation forward. When it's a lot about what you can't do and that's your starting position, it tends to move the energy and the person and the conversation in almost this retreat process. So that's what can be done in test and redesign. That gives you your professional boundaries, and it's also where you're working with clarity around the capacity. And we can talk more about this in Q&A as well. This all leads you to your authentic leadership with yourself, and potentially if you're in roles managing others or in a leadership position, this will clean up what your leadership looks like. What the chronic condition process will bring for you is a deep question about what is the career and the role that I really want, or who are the people I want to work with if I'm in a frontline role? What's the team environment that I want to be? Like, what is the way in which you want to work and how it works for you. It will bring up these conversations about capacity and learning how to navigate that from a healthy respect for your skills, respect for your body, and respect for you in the conversation about them. All of that will bring you expansion in your inner world and often in the external world. And it will shift as these deepen, as this process moves through. It will shift you from potentially thinking about yourself as a sick person and not wanting to be sick, or thinking about yourself as a person who burns all of your energy and then recovers at night or on the weekend, into somebody who has a sustainable practice, a sustainable way of working, and a sustainable way to navigate both the career and the chronic condition. And so that brings us to the end of the map. What I would like to do is have a bit of a chat. And I think, Cheryl, maybe if we can start, if people have questions, maybe pop on in that way. I'll just take the map back to the map, and then we can also talk about examples in this as well.
Excellent. Thank you, Michelle. We do have a question. Could you talk a little bit more about how do I talk about my capacity at work?
Great. So one of the things that it's a tool that I teach, it's a fantastic way that I felt first to get clear on myself, and then we teach it with leaders and organizations in chronic illness at work. And so I call it personally your circle of wellness. So if you think about it, instead of your being up at full capacity and optimal capacity or crash without capacity, if you think about your capacity, that it expands and contracts depending on what's happened. So contraction is your baseline, expansion is your optimal. And then if you are super clear what your capacity is at each of those processes or at each of those experiences, then you can actually use this notion of expanded and contracted capacity goes over super well with leaders when we explain it this way. They understand then that there's a flexing in the capacity. And so if you want to talk to somebody about it, you would share, so I'm navigating obviously this chronic condition and treatment. That means that my capacity has its baseline and then it has what it is at its most expanded optimal when everything is going well. Here's what I can do at my baseline, and I think that we want to focus on what is the greatest impact for how I work to get to that impact from that capacity. And then as my capacity might be in its most expanded, then obviously more can be taken on, or the timelines might shift, or this is how, it can be at my most expanded capacity. That capacity, this is my potential process and what I'm hearing from medical advice with clinicians. We need to start with where I'm at now and then scope it as things move and shift and change. What you can hear as I'm sharing that is that I'm really grounded in what my capacity is, and I'm not talking about what I can't do. I'm also super confident about how I'm having that conversation. So that confidence comes from literally, this is what I had to work out to do. Like I had to work out how to talk about this in a way that didn't have me just feeling like I'm consistently apologizing for being unwell. Being unwell is not a moral failing. It's a medical experience that I'm having or that you're having. And it's also the case that to have that confidence, you might want to start to test this conversation with a really trusted, non-judgmental friend who can not advise you how to have the conversation, but where you can practice having the conversation and strengthening it through repetition. Or if you have therapeutic support, it might be something that you work through in that process. What can happen is as you start to speak about it, you might feel a tightening in your throat, or as if they're like, it starts to get a bit congested and you feel a bit nervous about it. Here's how to work with that and strengthen your confidence. At the very beginning of the presentation, I talked about how to really get clear on your professional skills, your expertise, and what your resources are. That your creativity is your resource. Your capacity to sell, if you're in a sales position, that's actually your capacity. That is something that you are working in the company or the organization with, but it's actually your skill. If you revisit that to really get clear on your skills, it will strengthen your capacity in having this conversation, because you'll have that as a grounding for, actually, these are my skills, this is my capacity, and this is what I can do. I hope that helps. We're really, really happy to answer any questions as we move forward. Were there any more questions, Cheryl?
Yes. Here's another question. I work in a fast-paced, highly competitive field. I finally have my dream job, but I recently became sick with an autoimmune disease. I cannot keep up anymore, and I am nervous about keeping my role in the short term and my career in the long term. Any advice on how to navigate fear of job loss, lack of promotion, or retaliation at work?
Okay, very deep question. And I'm just swapping. So I'll come back to chat about this, because this is really an important question and there's a lot sitting underneath it. And I just want to check that everybody can hear me. We're all good in terms of clarity. Great. So what we can do in this process is think through what your resources are first and what your capacity is. If you just start with that baseline and you're optimal, it gives you somewhere to start. In the dream job, think about how that impact, what is the greatest impact you could have, and then get a little creative. And I'll give you an example, but I want to map this out for you first. We all think about, this is the role, this is the way it gets done, this is how you have meetings, this is exactly what's expected, this is how I then get to the impact. And it's like a pipeline of the way we do it. There are ways in which you can map out your pipeline of how you do the work that might be more easeful on your body and give you more capacity to do the work if we do it in a different way. So one example, this may not be right for you at all, but I want to give you a creative example so you can start to think about this. I have a beautiful executive client, has a number of chronic conditions, is used to going in and having people come into her office in and out all day, in and out all day. And her capacity to people with her condition is starting to really get exhausted by the continual train of people coming in and out of the office. So what we did with her was work out the criteria for when it's coming into the office and when it might be an email, and even with her team, when it might be a voice note. And that was very unusual to think about, but here's the reason that we thought about it. Coming in and out of the office, there's a whole lot of sensory conversation that's going on at that moment. And there actually only needs for her to meet with people to be met at a certain point in the project or for certain conversations. If in the process instead, she could get her thoughts and feedback out in a voice note, even if it was transcribed into an email, and then that went off to the person, that was more easeful for her body and more easeful for what was going on for her in terms of her capacity to consistently meet with people. So what I'm mapping out for you is to think about what is the impact of the role that we're looking for, And then what are the ways that I can creatively think about how that work gets done? The second part of this conversation is the bigger piece, and I'm going to give you a couple of tips about it. What usually happens in this is that we overlay tremendous mental and emotional pressure on the fear and confusion about our capacity and how we're going to meet all of the expectations. That's separate to working out our creative process. That's actually, I'm anxious and this is churning in me. If we come to your baseline and optimal and we work out how to ground your energy down in that confidence first, then you can have confidence that you will navigate it. It has to come into the internal, because once it's out with everybody else and their competition and how they're navigating it, I want you to think about the competition as humans being humans. Humans love to, you know, be on the go and be on the move and you know, be progressing. It's how we are. And so often competition at work, depending on the environment, it's almost predictable in the cycle of what's happening. If you're able to step back and see it as a cycle and just a pattern of what humans doing, it will give you a little bit of distance mentally and emotionally from feeling like you need to be involved in everything and be anxious about the competition in that way. Now, we're having this conversation in a very generalized way because that's as much as I can share with you in this sort of environment. The aim of what I'm looking for is a buffer between your psychological capacity and just yourself and your confidence and what's happening in the environment. And the wider we can get a buffer in your perspective there, the more capacity you will have to spend doing the work. Because that churn of what happens in environments can take up so much emotional labor and so much of your mental capacity that the more you can get, even incrementally, some spaciousness for yourself in perspective, and just know this is a completely predictable pattern. I know this pattern, I've seen this pattern, and I can work out how and when I consciously choose. This is a skill that becomes fundamental in navigating work with chronic illness, and it's a very important professional skill that comes with how do I professionally navigate this? Because what's happened is you've got all of your professional skills up until this date, and now you're working through what your professional skills are as a person navigating this with chronic illness. I hope that helps in some frame to give you some ideas.
Great. Thank you, Michelle. I think we have just one more question. And I think it's tied to, what if your work is unwilling to work creatively with you? What's your advice?
Okay, so there's two pieces to this advice. One, I can talk to you a bit about practical strategies or how to work with it. The other is that if you need support within your organization or support around the legalities of that process, that's a separate thing. And there's a reason that I'm mentioning that, is that often when we have an autoimmune condition and a chronic condition in that way, we think of ourselves as sick, when in fact sometimes we have a disability process in that. And I spent way too long thinking of myself as a sick person who was consistently trying to get well through medication and process, instead of actually thinking that this has a disability component. When I started to think about it as a disability component, that's obviously a huge psychological shift in identity, but it also would send me over into a different framework and a different policies in the organization. So that's the reason I'm mentioning that in itself, is to just look at the disability policies. The environment in which you are working may or may be different than it was maybe 12 months ago around this, but it's still worth for yourself. You don't have to mention it to anybody else, but it's worth for yourself having a look at that terrain. If I had done that instead of spending 10 years thinking I'm a well person who's currently sick, who's going to get well, without using what was available, I would have saved myself a lot of emotional and mental grief as well as physical stress. Over into if they are not willing to work with you creatively, couple of things. One, what can you work with creatively for you, for yourself, that doesn't need to be disclosed, the way in which you're working. If you're using transcript apps, or how can you work for yourself the way that works for you? How can you schedule? You don't have to share with everybody that you're doing all your email work in the morning or in the afternoon or whatever, in ways, because that's when you're better mentally. You can work that through. You can even do things like work out how to schedule your emails so that, you know, it looks like you're available for an hour, but actually what you've done is made it easeful for you so your brain can go off and do something else after it's reached capacity with emails. These are really small, simple things, but I'm just giving you throw out examples of how can you creatively work for it first for yourself, and then work out what are the things that actually need to be different for sustainability. And here is one of the ways to have that conversation in a new way. At least 30% of people working in your organization are living with at least one chronic condition. That's just data. That's just the fact. That's what people are doing. You don't know it. They don't know it. And certainly whoever you're reporting to may or may not know it. What that means is that learning how to navigate with people who are navigating a chronic condition is a leadership skill. It may be a hidden leadership skill at the moment, but it's actually a leadership skill. So if you know, you don't have to be the pioneer in everything, but if you know that this is a leadership skill that they have to get in order to navigate their career, then you can approach it from yourself as having a conversation where you know this is a conversation about leadership, professional skills. What that gives you is a bit more confidence around it not being so personalized for you to have the conversation, but actually that it's something that the culture is moving towards depending on the environment. If you can then think about how can this work differently, what are their, you know, like all negotiation, what are their absolute no's, and where do we think there might be flexibility, then start to operate for the small wins in the flexibility zone, and then see if that can migrate through others to more capacity in different ways. The number one thing to think about when that conversation is you think or you know, or they've said, no, 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 we can't do it, is to say, this is the impact, this is the capacity, so how might we do it? And that shifts your conversation. Because once it's about how might we do it, then you might get some more traction. Without specifics and without being in the room with you, that's the best I can offer you in a generic conversation.
Thank you, Michelle. Here is another question. We have someone who's currently looking to get back to work after a gap related to their condition and seeking treatment. And an issue that they're finding is addressing that gap in time and applications and interviews in a way that doesn't come off negative. Do you have any recommendations?
So people address this in lots of different ways. Some people address it as a career break. Some people address it as a health and well-being break. Here's one of the things that you may not have considered that is really useful. If you are returning and you have done any volunteer work, any at all, one of the things that I've worked with people around is in that gap that we actually look at what that volunteer work is, what that volunteer role is, and that helps with the gap. It can be the smallest organization or the smallest role. It is about thinking about it strategically so that that can go in the gap. The other thing is then to think about what is the process through which you do that. If it's a career break, it's a pretty standard conversation now that people have career breaks, and it could be that you talk about that as, you know, really feeling you reached the best of your capacity in a certain role and you were taking the break to realign and rethink through what was the right next step for you and shape it as a values conversation. The reason I'm talking about it as a values conversation is that sets you up to then be in relationship with the organization in interviews where you're talking about it as a values conversation. And then you're in the interview and it's like, so what are the values of this organization? And then you're actually moving forward rather than stuck in the past about what the gap was. And so these are the types of strategies that can help. The way in which the environment is shifting and working, one of the other things I would encourage you to do is a little thing that we call profiling. It's to have a look at people on LinkedIn who might have taken a break or a process that you may know are in your network, and just look at how they framed it and how they talked about it, particularly as they were re-emerging. Because what that gives you is just some other creative ideas, either in your industry or in your network, about how that worked. Now, it all depends on your industry and profession, but in this context, those are a couple of ways in which I would look at it.
Oops, I was on mute.
You
Sorry
were.
about that. We have another question. And it is someone who is recently diagnosed with thyroid eye disease and currently in the active phase of the condition. I work remotely in a fast-paced environment where I'm expected to be a key contributor, particularly when it comes to detail-oriented tasks like document review. Lately, I've been experiencing frequent headaches and a noticeable impact on my appearance, which has affected my confidence and overall comfort at work. I'm currently on FMLA. Do you have any recommendations for how to approach the on-ramp phase that might help me manage this transition more effectively while still contributing meaningfully?
Okay, so what I'm hearing, and I'd love if we could just clarify this even in the question in the chat, is that at the moment you're in the off ramp looking in towards the on ramping, and you're working with the medication to work out, okay, how am I going to on ramp back into the role that I've got, knowing what the environment is and what's expected in that. I'm just wondering, I want to make sure that I've got it. So if I have got it, I can speak to it.
Yes, that is correct.
Great. Okay, so I'm understanding the question. So there's a couple of things I would say in this for you. One is really work out that baseline and what you can do. What's happening at the moment is, and as you're on ramping, you really understand what the role is that was your role that you're going back to, and what the way in which it was done in that fast-paced environment. In that process, it might be that you can have a conversation about your capacity or the current medical impact, and that you can work out how you might do it in a slightly different way that is a very reasonable adjustment for you. That comes out of the medical condition. It is not you personally asking for them to adjust to you. It is giving them clarity about this is a medical condition and this is what the medical advice is about how I now navigate work. The part of you that is really super anxious about coming into that and working with that, I want to reassure you, 100% normal. Everybody on this webinar gets it, understands it, has experienced it. This is a phase where you are developing your confidence en route through having the conversations and moving with it forward. That is not the easiest thing to do, but in the on-ramping phase, look at the company values and whether or not there's some way in which you can talk about this in terms of the values and how you line up with the company mission and the values and how that then interfaces with the way that is sustainable for you. One of the things that shifts this conversation is to talk about this as this is what's sustainable. Obviously, we don't want, and this is the best of my capacity and the way in which this is sustainable for that capacity to be ongoing as I'm still in this recovery phase. And you can even talk about it as I'm returning to work in this way. Once you start to talk about sustainability, it again shifts the conversation from the 100% wellness or not at work to the sustainability of you giving the best and the most optimal impact. The words I'm using are very specifically chosen and very refined, and they're words that we've also tested with leaders to work out how to have this conversation. The only other thing I would offer in this is to really think through from the time that you've been navigating this in the cocoon stage, what is important to you and what sort of organization or role or way in which you work is important to you. And the reason I'm asking you to go back and just reflect on that so that you are in that process with what is important to you is that will ground you for the conversation instead of being out over with them and what the expectation is. You start from yourself about what is important. And then that will lead you, whether in this role, a new role, an adaptive role, it gives you the opportunity for it to start to open and expand rather than you trying to narrow into everybody's expectations. When you do that, you leave the center of you and you're out in their nervous system. When you're in what's important and how it works for me, it grounds you down. Doesn't mean it won't be uncomfortable. It will be uncomfortable, but you will get used to having those uncomfortable conversations with more confidence as you move through them. And at that point, that confidence will become quite strong that they will feel it and it will shift the conversation anyway.
Excellent. Wonderful questions from the community. And thank you so much, Michelle. I think we're
You're
just
welcome.
about at the top of the hour.
Shall we go to the handout, Cheryl?
Yes.
Let's go to what everybody will now have. So what we've put together that will be available for you is two things. One, you'll have the beautiful map, so you'll be able to refer to it. And we've got a little bit of a handout that can help you navigate it. There are three things at every stage just to give you a practical tool or reflection. One, where are you on the map? The second question is what helps here? And really work through what helps here first for you with yourself. What helps here where it helps you in your relationship with yourself? And then what other support might be appropriate in that stage? And then the third thing is what is important here for you? And that will also give you a place to work out practical strategies around those three questions. So it's really a starting point in this map. This is an introduction to the map. I hope that it's been useful. And these three questions are ways in which you can practically work with it.
Thank you. And those resources are available in the chat for everybody.
So I think that might bring us to closing remarks, Cheryl.
Excellent. Well, I want to thank each of you for taking the time with us today and hope you found the program valuable. As a reminder, you can find the handouts that Michelle just referenced in the chat. Someone says I see him in the chat. There's a PDF in the chat from Colleen to everyone. Just double check that. So we love doing these AIM programs and really want to be able to provide more of them that are useful for all of you. So if you could just take a moment now to scan the QR code and do our quick survey to let us know how we did, what you'd like to see more of, and where we can continue to improve, we'd really appreciate it. And then finally, I would really like to thank Michelle for sharing your expertise with us this evening, and the Autoimmune Association for collaborating with us to make this program available. We appreciate all of you, and I hope you have a great evening. Thank you.